everyone. Today we're going to talk about how climate change is linked to disease in Vermont. Particularly, we're going to talk about diseases that spread through parasites such as ticks or mosquitoes. The main examples of these types of diseases in Vermont is Lyme. As climate change unfolds, these diseases are expected to increase in severity. On the right, we have a graph showing a rise in cases of Lyme disease over the last couple decades. Now, this graph doesn't prove that climate change is behind the rise, but there are some logical links between the rise and climate change. First, with increasing temperatures, the habitable zones for these parasites are expanding and they're shifting around. Also, the parasites are reaching maturity faster with increased heat. The diseases are also incubating quicker inside the parasites. And finally, with increased rainfall and flooding, there's more stagnant water around, which can help parasites such as mosquitoes breed better.
Here's Dr. Dehill to explain more.
I think it's going to be a multi-pronged approach of vaccination and some vector control and I think climate change mitigation, because we've already seen over the past 50 years that the territory of these Aedes mosquitoes has expanded. And so it never used to be in the United States, so now it's now these mosquitoes have established a really robust foothold.
Vermont has the second highest rate for Lyme disease in the country. Symptoms will usually begin within 3 to 30 days after the tick has bit you, and in most cases this is totally treatable with a round of antibiotics. However, if this is left untreated, it can become a chronic issue for joints, nerves, and brain. And for one Vermonter, this led to chronic seizures. The challenge is that tests for Lyme are not always accurate. The CDC says a diagnosis should be based on symptoms, not just a blood test, because it can come back negative even if you've contracted the bacteria. So it's important to support educating the public and healthcare providers on prevention and symptoms of Lyme, because this will help with treatment before it becomes a lifelong condition for folks.
The spread of tick-borne diseases to humans, including Lyme disease and anaplasmosis, has been increasing in Vermont. If you camp, hike, work, or play in wooded or grassy areas, you could be bitten by an infected tick. Some simple precautions you can take to prevent your risk of getting Lyme disease is to use EPA-recommended insect repellents containing DEET. Make sure to wear clothes that cover your skin and check yourself for ticks daily, and especially after being in the outdoors. If you have a tick on you, you're going to want to remove it with fine-tipped tweezers as soon as possible. And if it is attached to your skin for less than 24 hours, your chance of getting Lyme disease is extremely small. However, you will still want to watch for symptoms of Lyme disease, such as rash or fever, over the next few weeks.